Hi, my name is Maria Isabel, and I'm going to talk about chapters 5 to 13. Um, the number one is chapter 5, Medical Practitioner 1. I'm going to read it. A. Practitioners. In Britain, doctors, also known as medical practitioners, must be qualified, have a university degree in medicine. They must also be registered, including the General Medical Council list or register, in order to practice. A doctor who treats patients as opposite to one who only does research is called a clinician. A doctor who provides primary care for patients is known as general practitioner (GP) or family doctor. GPs usually work in a group practice. Large group practice work in a building called a health center. Note: in British English, the verb is spelled practice and the noun is spelled practice. B. Specialties. Specialties doctors, for example pediatricians, generally work in hospitals. However, those who work outside the NHS providing private health care may have consulting rooms outside a hospital. For example, in the famous Harley Street in London. The two main branches of medicine are surgery and internal medicine, and the doctors who practice these branches are called surgeons and physicians, respectively. In Britain, male surgeons are addressed as Mr. and female as Mrs. So Dr. Smith is a physician and Mrs. Smith is a surgeon. A cardiologist, a geriatrician, anesthetist is a specialist in cardiologist specialized in diseases of the heart and circulation or cardiology. Geriatrician is a specialist in diseases of elderly patients of geriatrics. An anesthetist is a specialist in anesthetic. Note: names of specialists usually end in ology. Names of specialists usually end in ologist. If the name of a specialty ends in ECS, the name of the specialist ends in ECS. There are some exceptions: anesthetics and anesthetics. C. Choosing a specialty. Jill Matthews has just graduated from medical school and is talking about her future. I haven't decided what to specialize in yet. I need more experience before I decide, but I'm quite attracted to the idea of pediatrics because I like working with children. I certainly prefer to work with children than, say, elderly patients, so I don't fancy geriatrics. I was never very interested in detailing anatomy, so the surgical specialists like neurosurgery don't really appeal. You have to be good with your hands, which I don't think is a problem for me. I've assisted at operations several times, and I've even done some minor ops by myself. But surgeons have to be able to do the same thing again and again without getting bored, like trying off cut arteries and so on. I don't think that will be a problem for me, but they need to make decisions fast, and I'm not too good at that. I like to have time to think, which means surgery is probably not right for me. No, the collocation good with is followed by a noun. He is good with children. The collocation good at is followed by the ing from gerund of a verb or by a noun. She is good at explaining procedures. She is good at explanations. En la traducción es médicos, médicos practicantes, practicantes. En Gran Bretaña, los médicos también conocidos como doctores o médicos practicantes, deben estar calificados, tener un título universitario en medicina, también deben de estar registrados, incluidos en la lista del Consejo Médico General o registro para poder ejercer. Un médico que trata a los pacientes, a diferencia de uno que solo investiga, se llama clínico. Un médico que brinda atención primaria a los pacientes se conoce como médico general o médico de familia. Los médicos suelen trabajar de una práctica de grupo. La práctica de grupo más grande trabaja en un edificio llamado centro de salud. Nota, en inglés británico el verbo se deletrea práctica y el sustantivo se deletrea práctica. Especialidades. Los médicos especialistas, por ejemplo los pediatras, suelen trabajar en hospitales. Sin embargo, esos que trabajan fuera de S&S presentando asistencia sanitaria privada pueden disponer de consultorio fuera de un hospital. Por ejemplo, en la famosa Harley Street de Londres, las dos ramas principales de la medicina son la cirugía y la medicina interna, y los médicos que practican esas ramas se denominan cirujanos y médicos, respectivamente. En Gran Bretaña, a los cirujanos varones se les llama señor y a las mujeres señora, por lo que Dr. Smith es médico y la señora Smith es cirujana. Un cardiólogo se especializa en enfermedades del corazón y la circulación o cardiología, enfermedades de cardiología. Un geriatra se especializa en los pacientes de edad avanzada o geriatría. Un anestesiólogo o anestesista se especializa en anestésicos, anestesia. Nota, los nombres de las especialidades suelen terminar en ología, los nombres de los especialistas suelen terminar en ólogo. Si el nombre de una especialidad termina en IS, el nombre del especialista termina en INSHEN. Hay algunas excepciones como anestésico y anestesista. Elegir una especialidad. Jill Matthews se acaba de graduar de una facultad de medicina y habla sobre su futuro. Todavía no he decidido en qué especializarme, necesito más experiencia antes de decidirme, pero me atrae bastante la idea de la pediatría porque me gusta trabajar con niños. Ciertamente preferiría trabajar con niños que digamos que con pacientes ancianos, así que no me gusta la geriatría. Nunca me interesó mucho la anatomía detallada, por lo que de las especialidades quirúrgicas como la neurocirugía no me traen mucho. Tienes que ser muy bueno con tus manos, lo que no creo que sea un problema para mí. He asistido en operaciones varias veces e incluso he hecho algunas operaciones menores por mi cuenta, pero el cirujano tiene que ser capaz de hacer lo mismo una y otra vez sin aburrirse, como lidiar con arterias cortadas y demás. No creo que eso sea un problema para mí, pero necesitan tomar decisiones rápido y no soy muy buena en eso. Me gusta tener tiempo para pensar, lo que significa que la cirugía probablemente no sea adecuada para mí. Nota, la colocación bueno con Goodwill. La colocación bueno con Goodwill va seguida de un sustantivo, es bueno con los niños. La colocación good at va seguido de la forma ing serudo, es un verbo o de un sustantivo. Es para una explicación buena para procedimientos. Ella es buena en las explicaciones. O sea, she's good at explanations. Chapter 6. A medical practitioner 2. A. Hospital staff. The people who work in any type of workplace, including hospitals, are called the staff. The medical staff in a British hospital belong to one of four main groups: upper registrations, house officer, PRHO, or house officer is a newly graduate doctor in the first years of postgraduate training. After a year, he or she becomes a registered medical practitioner. In the current system of training, the Foundation Program, the name of these junior doctors is Foundation Year 1 Doctor, FY1. A Senior House Officer, SHO, is the second year of postgraduate training. The title is now Foundation Year 2 Doctor, FY2. But the old terms Senior House Officer and SHO are still used. A Specialist Register, SPR, is a doctor who has completed the Foundation Program and is training in one of the medical specialists. There are also some non-training registers, doctors who have completed their training but do not wish to specialize yet. A consult is a fully qualified specialist. There may also be some associate specialists, senior doctors who do not wish to become consultants. In addition, there is at least one medical or clinical director who is responsible for all of the medical staff. B. Medical teams. Consult physicians and surgeons are responsible for a specific number of patients in the hospital. Each consult has a team of junior doctors to help care for those patients. In many hospitals, there are multidisciplinary teams which consist not only of doctors but also of physiotherapists and other allied health professionals. When patients enter or are admitted to hospital, they are usually seen first by one of the junior doctors on the ward where they will receive treatment and care. The junior doctor clears them, takes their medical history, and examines them. Sometime later, the register also sees the patients and may order investigation of tests. For example, X-rays or an ECG, make a provisional diagnosis and begin treatment. The consultant usually sees the new admissions, people who have recently been admitted to the ward for the first time on one of the regular wards rounds when the management of the patient is discussed with the register. Consultants also decide when a patient is ready to be discharged, sent home. On the ward round, the consultant is accompanied by teams and nurse, and they visit all the patients in the consultant's care. C. Shifts. Junior doctors now normally work in shifts, which means they normally work for 8 hours every day. For example, 7 a.m. to 3 p.m. and are then free until 7 a.m. the next day. After a week, they change to a different shift, for example, 3 p.m. to 11 p.m. or 11 p.m. to 7 a.m. The alternative system is to work from 9 a.m. to 5 p.m. every day and to take turns to be on call. Unable to return to the hospital is, if necessary, from 5 p.m. to 9 a.m. the next day. Days on call are set out in a rota or list of names and times. Doctors on call carry a radio pager or beeper, a device which makes a noise when someone is trying to contact them. Médicos practicantes, 2. Un personal de hospital, una persona que trabaja en cualquier tipo de centro de trabajo, incluidos los hospitales, se denominan personal. El personal médico de un hospital británico pertenece a uno de los 4 grupos principales. Un oficial interno de preregistro, por sus siglas en inglés, u oficial interno, es un médico recién graduado en primer año de formación de posgrado. Después de un año, él o ella se convierte en médico registrado en el sistema actual de capacitación, el programa de fundación. El nombre de estos médicos jóvenes es doctor del año 1 de fundación. Un oficial superior de la casa es en el segundo año de formación de posgrado. El título es ahora fundación, el doctor del año 2 de la fundación, pero todavía se usan los términos antiguos, oficial superior de casa. Un registrador especialista es un médico que se ha completado el programa de la fundación y se está formando en una especialidad médica. También hay algunos registradores que no son de información, médicos que han completado su formación pero que aún no se deciden a especializarse. Un consultor es un especialista totalmente calificado. También puede haber algunos especialistas asociados, médicos señores que no desean convertirse en consultores. Además hay al menos un doctor médico clínico que es responsable de todo el personal médico. B. Equipos médicos. Los médicos consultores y los cirujanos son responsables de un número específico de pacientes en el hospital. Cada consultor tiene un equipo de médicos junior para ayudar a cuidar a sus pacientes. En muchos hospitales hay médicos multidisciplinarios que consisten no solo en médicos, sino también en fisioterapeutas y otros profesionales de la salud afines. Cuando los pacientes ingresan o son admitidos en el hospital, generalmente son vistos primero por uno de los médicos auxiliares en la sala donde reciben tratamiento o atención. El médico subalterno los atiende, toma su historial médico y los examina. Algún tiempo después, el registrador también se ve a los pacientes y puede ordenar investigaciones o pruebas, por ejemplo, radiografías, etc. Hacer un diagnóstico provisional y comenzar el tratamiento. El consultor suele ver las nuevas admisiones, personas que han sido admitidas recientemente en la sala, por primera vez en una de las rondas regulares de la sala, cuando se discute el manejo de los pacientes con el registrador. Los consultores también deciden cuándo un paciente está listo para ser dado de alta. En la ronda de sala, el consultor está acompañado con el equipo y una enfermera y visitan a todos los pacientes a su cargo. Letra C. Turnos. Los médicos jóvenes ahora trabajan normalmente en turnos, lo que significa que normalmente trabajan 8 horas todos los días, por ejemplo de 7 a 3 de la tarde, 7 a.m. a 3 de la tarde, y luego están libres hasta las 7 de la mañana del día siguiente. Después de una semana cambian un turno diferente, por ejemplo de las 3 de la tarde a las 11 de las 3 de la tarde a las 11 de la noche, o de las 11 de la noche hasta las 7 de la mañana. El sistema alternativo es trabajar de 9 a.m. a 5 p.m. todos los días y hacer turnos para estar de guardia, disponible para regresar al hospital si es necesario, de 5 p.m. a 9 a.m. del día siguiente. Los días de guardia se establecen en una lista de nombres y horas. Los médicos de guardia llevan un localizador de radio, un dispositivo que hace un ruido cuando alguien intenta comunicarse con ellos. 7. Nursing grades. Nurses working in a hospital have the following grades: student nurse, a nurse who is still in training; staff nurse, a nurse who has completed the training course; charge nurse, a more experienced nurse who is in charge of or responsible for a ward of department; nurse manager, a nurse who is in charge of several wards. Note, the old term sister is still sometimes used for a female charge nurse. A female nurse manager may be called matron. Dr. James is talking to Sister Watkins. B. Support workers. The clinical support worker who has done a short course and obtained basic qualifications, and the nursing auxiliary who is usually unqualified but assists nursing staff. There may also be ward clerks whose duties include making sure patients' notes and information are up to date and answering the telephone. C. Specialization. Like doctors, nurse can specialize. A midwife has specialized from the beginning by doing a course in the midwifery, the management of pregnancy and childbirth. District nurse visit patients in their homes, help visitors. Also work in the community giving advice of the promotion of health and the prevention of illness. D. The nurse role. The nurse role has changed considerably in recent years. In addition to general patient care, checking temperature, pulse rates, and blood pressures, changing dressing, giving injections, and removing sutures, nurses now do some of the things previously reserved for doctors, such as prescribing drugs and ordinary laboratory tests. More responsibility for nurses planned, as the following article demonstrates. Nurse carry out surgery in effort to cut patients' waiting lists. Nurses school and training to perform minor surgery have entered the operating theater for the first time in the effort to cut patient waiting times. 5 nurses who have passed a new course at the Glasgow Caledonian University are now qualified to carry out such procedures and the removal of small lesions, veins, mollusks, and cysts. The verbs performed and carried out are used with all types of procedures. They are often used the passive form: perform, carry out, an examination, an operation, a procedure, an experiment, a test, a biopsy. The procedure were performed or carried out by a nurse. Enfermeras. A. Grados de enfermería. Las enfermeras que trabajan en un hospital tienen los siguientes grados. Estudiante de enfermería. Una enfermera que todavía está en formación. Equipo de enfermeras. Una enfermera que ha completado el curso de formación. Enfermera a cargo. Una enfermera más experimentada que está a cargo o sea responsable para un barrio o departamento. Gerente de enfermería. Una enfermera que está a cargo de varias salas. Nota, el antiguo término hermana todavía se usa a veces para referirse a una enfermera a cargo o jefa de enfermeras. Puede llamarse matrona. El Dr. James ha hablado con la hermana Watkins. B. Trabajadores de apoyo. El trabajador de apoyo clínico que ha realizado un curso corto y obtenido calificaciones básicas y el auxiliar de enfermería que generalmente no está calificado ayudan al personal de enfermería. También puede haber empleados de sala cuyas funciones incluyen asegurarse de que las notas y las informaciones de los pacientes estén actualizadas y contestar el teléfono. Especialización. Al igual que los médicos, enfermeras pueden especializarse en. Una matrona se ha especializado desde el principio haciendo un curso de partería en manejo del embarazo y el parto. Las enfermeras de distrito visitan a los pacientes en sus hogares. Los visitadores de salud también trabajan en la comunidad dando consejos sobre la promoción de salud y prevención de enfermedad. En The Nurse Role, D. El papel de la enfermera. El papel de la enfermera ha cambiado considerablemente en los últimos años, además de la atención general del paciente, controlar la temperatura, el pulso, la presión, cambiar vendaje, aplicar inyecciones y quitar sutura. Las enfermeras ahora hacen algunas de las cosas que antes estaban reservadas para los médicos, como recetar medicamentos y solicitar pruebas de laboratorio. Está prevista una mayor responsabilidad de la enfermera, como demuestra el siguiente artículo. Las enfermeras realizan cirugías en un esfuerzo por reducir las listas de espera. De los pacientes en Escocia, las enfermeras capacitadas para realizar cirugías menores han ingresado al quirófano por primera vez en un esfuerzo por reducir los tiempos de espera de los pacientes. 5 enfermeros que aprobaron un nuevo curso de la Universidad Glasgow Collegians ahora están calificadas para llevar a cabo procedimientos tales como extirpación de pequeñas lesiones lunares benignos y quistes. Los verbos realizar y llevar a cabo se utilizan con todo tipo de procedimientos. A menudo se utilizan en forma pasiva. Realizar, llevar a cabo una examinación, una operación, un procedimiento, un experimento, una prueba, una biopsia. El procedimiento fue realizado por una enfermera o llevado a cabo. Chapter 8. Allied Health Professionals. A. Community health. The health of the community depends on a large number of people other than medical practitioners and nurses. This can be grouped under the heading of allied health professionals. They include the following: physiotherapists, physios, help people to move by getting them to do exercise or by treating their body with heat of massage treatment by manipulating muscle and joints with the hands. Occupational therapists, OTs, help people with a disability to perform tasks at home and work. A disability is a physical or mental condition that makes it difficult to live normally, for example, blindness or deafness. Social workers help people to solve their social problems, for example, poor housing or employment or family problems. Chiropodists, also known as podiatrists, treat conditions affecting the feet. C. Technicians. There are numerous technicians, people who work with scientific equipment, such as radiographers, who are known as X-ray technicians. Ambulance technicians work in the emergency medicine service. An ambulance technician with more advanced qualification is called a paramedic. C. Prosthetists and orthotists. Prosthetists and orthotists provide care for anyone who needs an artificial limb, a prosthesis, or a device to support control part of the body, and orthosis. They also advise on rehabilitation, helping patients return to normal life and work after treatment. Prosthetists provide artificial replacements for patients who have had an amputation or were born without a limb. orthotists provide a range of splints and other devices to aid movements, correct deformity from an abnormal development of part of the body, for example, clubfoot, talipes, and relief pain. The opticians. Opticians test eyesight and prescribe glasses, also known as spectacles and contact lenses when necessary. The examination includes measuring intraocular pressure, the pressures of the fluid inside the eye, and examining the retina if the optician suspects an eye disease such as glaucoma. They refer the patient to their GP for treatment. The GP may then refer the patient to the ophthalmologist and doctor who specializes in the issues of the eye. Profesionales de la salud aliados, o salud A1 o A. Salud comunitaria. La salud de la comunidad depende de un gran número de personas, además de médicos y enfermeras. Esto se puede agrupar bajo el título de profesionales de la salud aliados. Incluye lo siguiente: los fisioterapeutas ayudan a las personas a moverse haciéndolas hacer ejercicio, tratando su cuerpo con calor o masaje, tratamiento manipulado a los músculos y articulaciones con la mano. Los terapeutas ocupacionales ayudan a las personas con discapacidad a realizar tareas en el hogar y en el trabajo. Una discapacidad es una condición física o mental que dificulta vivir normalmente, por ejemplo, ceguera o sordera. Sordera sería, maybe. Los trabajadores sociales ayudan a las personas a resolver sus problemas sociales, por ejemplo, viviendas deficientes, desempleo, problemas familiares. Anyways. Los podólogos, también conocidos como eso mismo, tratan afecciones que afectan a los pies. B. Hay numerosos technicians. Hay numerosas personas que trabajan con equipos científicos como radiógrafos que se conectan como técnicos de rayos X. Los técnicos de ambulancia trabajan en el servicio de medicina urgente o de urgencias. Un técnico de ambulancias con calificaciones más avanzadas se llama paramédico. C. Protésicos y ortesistas. Los protésicos y ortopedistas brindan atención a cualquier persona que necesita un miembro artificial, una prótesis o un dispositivo para sostener o controlar una parte del cuerpo, una órtesis. Ellos también asesoran sobre rehabilitación, ayuda a los pacientes a volver a la vida normal y el trabajo después del tratamiento. Los protésicos proporcionan reemplazos artificiales para pacientes que han tenido una amputación o nacieron sin una extremidad. Los ortopedistas proporcionan una variedad de férulas y otros dispositivos para facilitar el movimiento, corregir la deformidad de un desarrollo anormal de una parte del cuerpo, por ejemplo el pie, y aliviar el dolor. La D, que es ópticos. Los ópticos examinan la vista y recetan anteojos, también conocidos como lentes. Lentes de contacto cuando es necesario. El examen incluye medir la presión intraocular, la presión del líquido dentro del ojo y examinar la retina. Si el óptico sospecha una enfermedad ocular como glaucoma, remite al paciente a su médico de cabecera para recibir tratamiento. Luego el médico de cabecera puede derivar al paciente a un oftalmólogo, un médico que se especializa en enfermedades de los ojos. 9. Hospitals. A. Introduction to a hospital. Jordi Pons is a 4-year medical student from Barcelona. He has come to Britain on an elective attachment to the Royal Infirmary, Edinburgh. Dr. Barham is introducing him to the hospital. Dr. Barham. The Royal Infirmary is the name of the University Hospital for Edinburgh University. It's a general hospital dealing with all types of patients and illness, except pediatrics. We have a specialist hospital for that in another part of Edinburgh, the Hospital for Sick Children. You can see some of the departments in our hospital on the sign. Of course, there are many others, for example, the Intensive Care Unit, ICU, and the Surgical High Dependency Unit, HDU. Jordi. What does outpatients mean? Dr. Barrow. Outpatients are the people who come to hospital to attend a clinic or to have tests of treatment and then return home on the same day. Inpatients stay in the hospital for 1 or more days. The rooms where they stay are called wards. If a patient's treatment requires only 1 day, such as a simple operation, they can be admitted to the day surgery unit. Welcome to the Royal Infirmary. Student trains, car park, CND, visitors and staff. The System Center for Reproductive Health, Gynecology, Maternity, Neonatology, outpatient departments, wards, day surgery unit and endoscopy. X-ray department, combine assessment. B. Outpatients. Dr. Baron, the accident and emergency department, A&E, also called consultee, is where patients who are acutely ill with a sudden serious condition confer assessed and treatment. Outpatients who have an appointment to see a specialist go to the clinic in one of the outpatient departments, OPDs. They have usually been referred to the hospital by their GP, who writes a referral letter to the consultant explaining the patient's problem. C. Inpatients. Dr. Baron. The inpatients in a hospital are admitted in one of three main ways. They may be seen in one of the outpatient clinics and admitted from there, or if there is a lot of demand for the treatment they need, as in the case of a hip replacement, they are put on a waiting list for admission. Alternatively, their GP may arrange the admission by telephone because they are acutely ill, for example, with suspect myocardial infarction, or they are seen in the A&E department where the doctor on duty working at the time arranged the admission. This would happen in the case of the patient with a fractured neck or femur. For example, larger hospitals may have an assessment unit where patients can be admitted temporarily while their condition is assessed. Jordi, assess Dr. Baron. Yes, decisions are made about their condition and what needs to be done to help them. After treatment is complete, the patient is discharged back to the GP's care. Hospitales, capítulo 9. Introducción a un hospital. Jordi Ponce es un estudiante de cuarto curso de medicina de Barcelona. Ha venido a Gran Bretaña en un archivo adjunto electivo al Royal Infirmary de Burgos. El Dr. Baron lo está presentando al hospital. Dr. Baron, The Royal Infirmary es el nombre del hospital universitario de la Universidad de Edimburgo. El hospital general que atiende a todo tipo de pacientes y enfermedades, excepto pediatría. Tenemos un hospital especializado para eso en otra parte de Edimburgo, el Hospital for Sick Children. Puede ver algunos de los departamentos de nuestros hospitales en el cartel. Bienvenido a la Enfermería Real. Apartamento C de visitante personal de Simpson Center for Reproductive Health, ginecología, urgencia, maternidad de emergencia y neonatología, urgencia. Todos los barrios, departamento de rayo X, población combinada. Por supuesto, hay muchos otros, por ejemplo, la unidad de cuidados intensivos, UCI y el quirúrgico, unidad de alta dependencia. Bien. Jordi, ¿qué significa ambulatorio? Dr. Brando, pacientes ambulatorios son las personas que vienen al hospital para asistir a una clínica o para someterse a pruebas o tratamientos y luego regresar a casa al mismo día. Los pacientes internados permanecen en el hospital durante 1 o más días. Las habitaciones donde se hospedan se llaman salas. Si el tratamiento de un paciente ambulatorio requiere solo de un día, como una operación simple, se puede ingresar en la unidad de cirugía de día. B. Pacientes ambulatorios. Dr. Brandon. El departamento de accidentes y emergencia, también llamado consulting, es donde los pacientes que están gravemente enfermos o una condición repentina y grave acuden para evaluación y tratamiento. Los pacientes ambulatorios que tienen una cita para ver a un especialista van a una clínica en uno de los departamentos de pacientes externos. Por lo general han sido permitidos al hospital por su médico de cabecera, quien describe una carta de referencia al consultorio explicando el problema del paciente. C. Paciente hospitalizado. Doctor Brando, los pacientes internados, hospitalizados en un hospital son admitidos de una a 3 formas principales. Puede ser atendido en alguna de las consultas externas e ingresado desde allí, o si hay mucha demanda del tratamiento que necesitan, como en el caso de una prótesis de cadera, se les pone en lista de espera a su ingreso. Alternativamente, su médico de cabecera puede organizar la admisión por teléfono porque están gravemente enfermos, por ejemplo, con sospecha de infarto de miocardio, o se les atiende en urgencias, donde el médico de guardia en el momento gestiona el ingreso. Esto ocurriría en el caso de un paciente con fractura de cuello de fémur. Por ejemplo, los hospitales más grandes pueden tener una unidad de evaluación donde los pacientes pueden ser admitidos temporalmente mientras se evalúa su condición. Jordi, evaluado. Doctor Barrow, sí, se toman decisiones sobre su condición y lo que se debe hacer para ayudarlos. Una vez que se complete el tratamiento, el paciente es dado de alta nuevo al cuidado del médico de cabecera. Chapter 10, Primary Care. A. The National Health Service. The National Health Service, NHS, is responsible for health care for everyone in the UK, although a small number choose to pay for private care. Treatment is free, but there is a prescription charge for drugs and appliances, such as cervical collar, with exceptions for some patients, such as children and the elderly. Primary care is provided by general practitioners or GPs, sometimes known as family doctors, nurses, dentists, pharmacists, and opticians. GPs work in practice of 1 to 20. Practice are based in a surgery and look after the health of from 1,000 to 50,000 people in their local community. They also provide health education in areas such as smoking and diet. From clinics give vaccination, for example, for influenza, and may perform minor surgeries such as removal of warts and moles. If a patient needs specialist care, the GP will make a refer the patient to the consultant in secondary care. Patients are normally seen on appointments basis. Home visits are made when patients are housebound, unable to leave their homes, or too ill to attend surgery. Out of hours OOH treatment from 6 p.m. to 8 a.m. is provided by the local primary care trusts, which organize shifts of GPs and locum GPs to record if someone is absent. Note that now surgery has 3 meaning. The building where GPs work, the practice has moved to a new surgery of the high streets. A time when GPs sees patients, morning surgery is from 8:30 to 12:30. The work of surgeons, the patient needs urgent surgery of a burst appendix. B. The practice team. A typical GP practice employs receptionists. They are responsible for initial patient contact, making appointments, taking requests for repeat prescriptions, taking messages from patients and other healthcare providers, and for filling and scanning documents into patients' records. The practice manager has responsibility for finance and sometimes for IT, supervise reception staff, hires locums, and helps prepare the practice development plan. Practice nurses run asthma, diabetes, and cardiovascular disease clinics, as well as 1-to-1 clinics for those who wish to give up smoking. In addition to practice staff, GPs work with a number of health professionals. District nurses visit temporarily housebound patients, such as recently discharged hospital patients, to change dressing, such as ulcer dressing. Health visitors visit families to carry out check-ups on young children, particularly under 5, to make church, sure, they're healthy. Special attention is paid to families in need, such as those living in poverty. They also do baby immunization. Midwives run clinics for antenatal patients. Physiotherapists provide hands-on treatment, but also teach patients exercise they can do to improve their condition after an accident or operation. At GP's Day, Dr. Stewart works in a practice in a small market town with 3 other family doctors. The surgery is in the center of the town and the church chaired by 3 practices. This is a typical working morning when she is now the duty doctor responsible for emergency and urgent problems. 8 a.m. Arrive at the surgery, check the OOH email print out, check for urgent and non-urgent message. 8:30 a.m. Check email from the health board and partners prepare for surgery. 8:30 to 10 to 5 a.m. Morning surgery, 10 minutes appointment, 6 per book. Last week 2 books, 48 hours ahead for book able on the day. 10:55 a.m. Check with reception for medicine, sign prescription and deal with repeat prescription. 11 to 11:20 a.m. Coffee break in the conference room with college. 11:20 to 11:30 a.m. Check home visit requests and divide up visit with A. 11:30 a.m. to 1 p.m. home visits. And primary care o atención primaria, whatever, el Servicio Nacional de Salud. El Servicio Nacional de Salud es responsable de la atención médica para todos en el Reino Unido, aunque un pequeño número opta por pagar la atención privada. El tratamiento es gratuito, pero hay un cargo por prescripción de medicamentos y aparatos, como un collarín cervical, un collarín, con excepciones para algunos pacientes como niños y ancianos. La atención primaria está a cargo de médicos generales o médicos de cabecera, a veces conocidos como médicos de familias, enfermeras, dentistas, farmacéuticos y ópticos. Los médicos de cabecera trabajan en prácticas de 1 a 20. Las prácticas se basan en una cirugía y cuidan la salud de 1,000 a 15,000 personas en su comunidad local. También brindan educación sobre la salud en áreas como tabaquismo y la dieta. Administran clínicas, administran vacunas, por ejemplo contra la influenza, y pueden realizar cirugías menores como la eliminación de verrugas y lunares. Si un paciente necesita atención especializada, el médico de cabecera hará una derivará al paciente a un consultor en atención secundaria. Los pacientes normalmente se ven con cita previa. Las visitas domiciliarias se realizan cuando los pacientes están confundidos y no pueden salir de sus hogares o están demasiado enfermos para asistir a la cirugía. El tratamiento fuera del horario de atención OOH de las 6 p.m. a 8 a.m. lo brinda el Primary Care Trust Local, que organiza los turnos de médicos generales. Primary Care Trust Local que brinda la atención primaria. Y médicos suplentes para cubrir si alguien está ausente. Nota, el sustantivo cirugía tiene significado como la división de funcionarios GPS, el GPS, el General Practitioner, GP Works. El tiempo en que el médico general se ve a los pacientes, en que el trabajo de los cirujanos. Practice Team B, el equipo de práctica. Una práctica típica de médico de cabecera emplea recepcionistas. Son responsables del contacto. Inicia con el paciente, concertar citas, recibir solicitudes de recetas repetidas, recibir mensajes de pacientes y otros proveedores de atención médica y archivar y escanear el documento en los registros de los pacientes. El gerente de práctica tiene la responsabilidad de las finanzas y a veces de TI. Supervisa el personal de recepción, Contrata suplentes y ayuda a preparar el plan de desarrollo de práctica. Los enfermeros practicantes dirigen clínicas de asma, diabetes y enfermedades cardiovasculares, así como clínicas individuales para aquellos que desean dejar de fumar. Las enfermeras de distritos visitan a los pacientes temporalmente confinados en el hogar, como los pacientes hospitalizados recientemente, dados de alta para cambiar los apósitos como los que tienen úlcera. Los visitadores sanitarios visitan a la familia para realizar chequeos a los niños pequeños, en particular menores de 5 años, para asegurarse de que estén sanos. Se presta especial atención a las familias necesitadas como las que viven en la pobreza. También vacunan a los bebés. Las parteras administran clínicas para pacientes prenatales. Los fisioterapeutas brindan tratamiento práctico, pero también les enseñan a los pacientes ejercicios que pueden hacer que mejoren su condición después de un accidente u operación. El doctor Stuart trabaja en un consultorio en un pequeño pueblo comercial con otros 3 médicos de familia. La consulta se encuentra en el centro del pueblo y él compartida por 3 consultorios. Esa es una típica mañana de trabajo en la que ella no es médico de guardia, responsable de emergencia y programa de urgencia. A las 8 de la mañana llega la cirugía, verifica el cheque de impresión de correo electrónico, el mensaje de urgencia. Luego prepara para la cirugía matutina y firma de receta y gestionar de recetas repetidas en la sala, solicitud de visita domiciliaria y dividir la visita. Medical Education 1. Medical Education 1. A. Medical Education in the UK. Medical Education in the UK covers undergraduate education for over 5 years at medical school, the section of as university responsible for medical education. A 2-year foundation program which provides training for new doctors after graduation through a series of placements in different specialties. Postgraduate training which doctors take to become GPs or consultants, senior specialists, often delivered through college for different specialties. For example, the Royal College of Physicians. Continue professional development in the form of courses and seminars which doctors undertake throughout their working lives to keep up to date. B. Extract from an undergraduate prospectus. The MBCHB. Bachelor of Medicine, Bachelor of Surgery is a 5-year undergraduate medical degree course. Most of your learning takes place in the small groups. The main components are core, years 1 to 3, an integrated program of clinical and scientific topics mainly present through problem-based learning (PBL), where you work with others on a series of case problems. Students select modules. SSMS allow you to choose from a menu of subjects such as sports medicine, or even study a language as preparation for an overseas elective, a hospital attachment of your own choice between years 4 and 5. Vocational studies and clinical skills. This component prepares you for the clinical skills required for contact with patients from years 1 of your course through periods of practical training where you are attached to a hospital department on general practice. Clinical attachment year 4 and 5, a series of 4-week clinical attachments in medicine, surgery, psychological medicine, child health, obstetrics and gynecology, and general practice. C. A student's view. Ellen, a medical student, describes her course. I'm just finishing my first year of medicine. What I like about this course is that you're involved with patients from the very beginning. Even in our first years, we spend time in hospital, much of the course in PBL. We have 2 hour sessions a week where we work in the group of 8 to test solving clinical problems. We decide together how to tackle the problem, look up books and online sources, make notes, and discuss the case together. It's a great way of learning and getting to know the other students. In the past, medical students had lectures with the whole class taking notes from lecturers from 9.00 to 5.00, but now it's mainly group work, although we do have some lectures and seminars. Where we work in the small groups, we are tutor. I like all of it, even this section. We get to cut up cadavers from the second month of the course. And in Spanish is Educación Médica 1, Educación Médica en el Reino Unido. Educación Médica en el Reino Unido cubre la educación universitaria, que es 4 o 5 años en la escuela médica, la sección de una universidad responsable de la educación médica, un programa básico de 2 años, que brinda capacitación para nuevos médicos después de la graduación a través de una serie de prácticas en diferentes especialidades, consulta, la formación de posgrado, que son los médicos que toman para convertirse en GPS, en médico practicante, o consultores, especialistas superiores, a menudo impartidos a través de colegios para diferentes especialidades. Por ejemplo, el Royal College of Physicians, el desarrollo profesional continuo en forma de discursos y seminarios que los médicos emprenden a lo largo de su vida laboral para mantenerse. B. Extract from Graduate Prospectus, el día de extracto de un prospecto de pregrado. El MB-CHB, el MB-CHB, licenciatura en medicina y licenciatura en cirugía, es un curso de pregrado en medicina de 5 años. La mayor parte de su aprendizaje se lleva a cabo en grupos pequeños. Los componentes principales son el básico, año 1 y 3, un programa integrado de temas clínicos y científicos presentado principalmente a través del aprendizaje basado en problemas del PBL, donde trabaja con otros en una serie de problemas de caso, módulos seleccionados por el estudiante. Los módulos seleccionados por el estudiante, SSM, le permite elegir entre el menú de materias como medicina deportiva, estudiar un idioma con preparación para una cirugía en el extranjero. Elegir un archivo adjunto de un hospital de su propia elección en el año 4 y 5. Estudios vocacionales y habilidades clínicas. Este componente lo prepara para las habilidades clínicas requeridas para el contacto con pacientes desde el año 1 de su curso a través de periodos de capacitación práctica en los que está inscrito a un departamento hospitalario práctico general. Adjuntos clínicos, años 4 y 5, una serie de adjuntos clínicos de 4 semanas en medicina, cirugía, medicina psicológica, salud infantil, obstetricia y ginecología en medicina general. El apartado C, la vista de un estudiante. Él es un estudiante de medicina, describe su curso. Estoy terminando mi primer año de medicina. Lo que me gusta de este curso es que involucras con los pacientes desde el principio. Incluso en nuestro primer año pasamos el tiempo en el hospital. Grande parte del curso es PBL, problemas, lo mismo. Tenemos 2 sesiones de 2 horas a la semana donde trabajamos en grupos de 8 a 10 resolviendo problemas clínicos. Decidimos juntos cómo abordar el problema, buscamos libros y fuentes en línea, tomamos notas y discutimos el caso juntos. En una gran manera de aprender y conocer a otro estudiante. En el pasado los estudiantes de medicina tenían conferencias con toda la clase tomando notas de los profesores de 9 a 5, pero ahora es principalmente trabajo en grupo, aunque tenemos algunas conferencias y seminarios donde trabajamos en pequeños grupos con un tutor. Me gusta todo, incluso la disección. Llegamos a descuartizar cadáveres a partir del segundo mes de curso. Medical Education 2, Chapter 12. A. The Foundation Program. The Foundation Program is a 2-year training program which forms the bridge between university-level study and at medical school and specialists of general practice training. It consists of a series of placements each lasting 4 months, which allow the junior doctor, known as trainee, to sample different specialties, for example, pediatrics. A year 1 training, FY1, corresponds to pre-registration house officer (PRHO) posts, and a year 2 trainee, FY2, to senior house officer (SHO) posts. Each trainee has an educational supervisor who ensures that more senior doctors deliver training in different ways, including clinical and educational supervision. To progress, trainees have to demonstrate a range of clinical competencies which are assessed through observation on their workplace. B. People in medical education, tutor, an academic or in some case a postgraduate student who leads tutorials, demonstrator in an anatomy teaching, someone who demonstrates how to dissect. Demonstrators are often postgraduate students paying their way through medical education. Lecturer, senior lecturer, an academic with teaching and research responsibilities who contributes to the teaching of a particular discipline. Professor, a senior academic with teaching on research responsibilities for a particular discipline, usually a leading figure in their discipline. College tutor, a consultant responsible for delivering a college training program. Clinical trainer, a consultant assigned to a trainee who provides training during a period of direct clinical care. Educational supervisor, a consultant who supervises a trainee period of training. C. Medical qualifications. BMSc, BMEd-SCI. Bachelor of Medical Science, a degree often taken after 3 years of medical studies by students who may wish to follow a career in medical research. MB-CHB, MBBS, and BMB-CHB, MBS. Bachelor of Medicine, Bachelor of Surgery. Bachelor degree are undergraduate degrees. This is the first degree for UK doctors. MD-DM, Doctor of Medicine. DRCOG, Diploma of the Royal College of Obstetrics and Gynecology. MRCP, MRCS. Member of the Royal College of Physicians or member of the Royal College of Surgeons. Doctors become members by successfully completing the assessment procedures in their college. FRCS, FRCSE, FRCS Class, FRCSI. Fellow of the Royal College of Surgeons of England. Other colleges are indicated by the letters which follow, for example, in Edinburgh, Glasgow, or Ireland. How doctors become a fellow depends on their college for the FRCS. For examinations must be passed. For other colleges, it is by nomination or work assessment. Ahora en español. Educación Médica 2, el programa de la fundación. El programa básico es un programa de capacitación de 2 años que constituye el puente entre los estudios del nivel universitario en la escuela de medicina y la capacitación especializada o de práctica general. Consiste en una serie de estancias de 4 meses de duración cada una, que permiten al médico junior conocido como trainee probar diferentes especialidades. Por ejemplo, pediatría. Un aprendiz del año 1 corresponde a los puestos de oficial de casa de preregistro y un aprendiz del año 2 a los puestos de oficial superior de la casa. Cada entrenamiento tiene un supervisor educativo que se asegura de que los médicos más experimentados brinden capacitación de diferentes maneras, incluida la supervisión clínica y educativa. Para progresar, los alumnos deben demostrar una serie de competencias clínicas que se evalúan a través de la observación en su lugar de trabajo. Personas en educación médica, tutor, un académico o en algunos casos un estudiante de posgrado que dirige las tutorías, un demostrador. En la enseñanza de la anatomía, alguien que demuestra cómo diseccionar. Los manifestantes suelen ser estudiantes de posgrado que pagan sus estudios en las facultades de medicina. Profesor tutor o profesor titular, un académico con responsabilidades de docencia e investigación que contribuye a la enseñanza de una disciplina en particular. Profesor, un académico senior o con responsabilidades docentes y de investigación para una disciplina en particular. Suele ser una figura destacada en su disciplina. Profesor universitario, un consultor responsable de impartir una formación universitaria programada. Entrenador clínico, un consultor asignado a un aprendiz que brinda capacitación durante periodos de atención clínica directa. Supervisor educativo, un consultor que supervisa el periodo de formación en un aprendiz. Cualificaciones médicas, BMC, BMSC, BMD, SCI. Licenciado en Ciencias Médicas, un título que a menudo obtienen después de 3 años de estudios médicos los estudiantes que desean seguir una carrera en medicina e investigar. MBCH, BMBBS, licenciado en Medicina, licenciado en Cirugía. Los títulos de licenciatura son títulos de grado de BMBS y BMBS. Ese es el primer título para médicos del Reino Unido. MD, diploma de doctor. DRCOG, medicina del Royal College of Obstetrics and Gynecology. CPRMMRC, miembro del Real Colegio de Médicos o miembro del Real Colegio de Cirujanos. Los médicos se convierten en miembros por éxito. Completar los procedimientos de evaluación en su colegio. FRCS, FRCSD, FRCSS, GLAS, FRCSI. Miembros del Royal College of Surgeons en England. Otras universidades son indicados por la letra que siguen, por ejemplo, en Edimburgo, Glasgow o Irlanda. La forma en la que los médicos se convierten en becarios depende de su universidad. Para el FRCS se deben aprobar exámenes adicionales. Para otro colegio es por nominación o evaluación de trabajo. Chapter 13. The Overseas Doctor. 8. Types of registration. To manage a treated patient in the UK, all doctors must register with the General Medical Council. There are several types of registration. Provisional registration is for doctors who have just qualified from medical school in the UK or from certain European Economic Area member states. Full registration is for doctors who have completed their year's clinical training. Limited registration is for international medical graduates who have not completed the equivalent of a year's clinical training in the UK. Specialist registration is for doctors who have completed specialist medical training and have certificate of completions of training. The GP register is a register of all those eligible to work in general practice in the NHS. PLAB. Before they can obtain full registration, some categories of overseas doctors are required to take the Professional and Linguistic Assessment Board test. PLAB is designed to ensure those who pass can practice safely at the level of a show in a first appointment in a UK hospital. Part 1 consists of a writing test of knowledge, skill, and attitudes. Part 2 is an objective, structured clinical examination. It consists of 16 5-minute clinical scenarios known as stations to assess professional skills. PLAB Station and Advice. OSCES. Assess this skill. Clinical examination. Your ability to carry out a physical examination of a simulated patient and an actor training to play this role will be assessed. Uncomfortable or intimate examination will be carried out using mannequin and an anatomical model. Practical skill. You will be assessed on practical skills such as suturing and giving intravenous injections. Communication skills, your ability to interact with a simulated patient, or in some cases the examiner, will be assessed. Skill tests may include breaking bad news and giving advice of lifestyle. History taking, your ability to take an accurate story and make a reasoned diagnosis will be assessed. Advice on the stations from a successful candidate. Read instructions outside each station carefully. You have 1 minute for this. Don't forget the ABC, airways, breathing, circulation, protocol in every emergency station. Keep in mind safety precautions like throwing the sharps in the sharps bin. Check the patients understand what is happening, then ask them about any concerns they may have. Don't just keep a lecture. Listen carefully to what the actor says. Note: sharps are needles and balls which must be disposed of safely in a special container called a sharps bin. Ahora en español, médicos extranjeros, tipos de registro. Para administrar y tratar pacientes en el Reino Unido, todos los médicos deben registrarse en general. Consejo médico, hay varios tipos de registro. Provisionales para médicos que acaban de graduarse en la Escuela de Medicina en el Reino Unido o de ciertos estados miembros del Espacio Económico Europeo. La inscripción completa es para médicos que han completado su año de capacitación clínica. La inscripción limitada es para graduados médicos internacionales que no hayan completado el equivalente a un año de formación clínica en el Reino Unido. El registro de especialista es para médicos que han completado la formación médica especializada y tienen un certificado de finalización de la formación. El registro GP es un registro de todo lo elegible para trabajar en la práctica general en el NHS. El PLAB, antes de que puedan obtener el registro completo, algunas categorías de médicos extranjeros deben realizar la prueba de la Junta de Evaluación Profesional Lingüística. Está diseñado para garantizar que quienes aprueban pueden practicar de manera segura a nivel de un CHO o una primera cita en un hospital del Reino Unido. La parte 1 consiste en una prueba escrita de conocimiento, habilidades y actitudes. La parte 2 es un objetivo examen clínico estructurado. Consta de 16 escenarios clínicos de 5 minutos. Conocidos como estaciones para evaluar las competencias profesionales. Las estaciones PLAB y los OSSD. Examen clínico se evaluará su capacidad para realizar un examen físico de un paciente simulado, un actor entrenado para desempeñar este papel. Incómodo íntimo, los exámenes se realizarán utilizando un maniquí y un modelo anatómico. Habilidades prácticas. Se evaluará en habilidades prácticas como suturar y dar inyecciones intravenosas. Habilidades de comunicación. Se evaluará su capacidad para interactuar con un paciente simulado o en algunos casos con el examinado. Las habilidades evaluadas pueden incluir dar malas noticias y dar consejos sobre el estilo de vida. La elaboración de la historia clínica. Se evaluará su capacidad para elaborar una historia precisa y realizar un diagnóstico razonado. Consejos sobre las estaciones de un candidato exitoso. Lea las instrucciones fuera de cada estación con cuidado. Tienes 1 minuto para esto. No olvides el protocolo ABC, vías aéreas, liberación y circulación. En cada estación de emergencia. Verifique que el paciente comprenda lo que está sucediendo. Luego pregúntales acerca de cualquier inquietud que puedan tener. No se limite a dar conferencias. Escuche atentamente lo que dice el actor. And now I'm going to talk about the exercise chapter 5 to 13. And let me see. 5.1 Write a sentence to describe the work of specialists in each branch of medicine. Look at B opposite to help you. 1. Dermatology. A dermatologist specializes in diseases of the skin. 2. Rheumatology. A rheumatologist specializes in diseases of the joints. 3. Traumatology. A traumatologist specializes in accident and emergency medicine. 4. Pediatrics. A pediatrician specializes in diseases affecting children. 5. Obstetrics. An obstetrician specializes in managing Precognitions. 5.2. Complete the table with words from A, B, and C opposite and related forms. Put a asterisk mark in front of the asterisk syllable in each word. The first one has been done for you. Verb. Specialize. Specialist. Specialty. Practice. Practitioner. Practice. Consult. Consultant. Consultation. Assistant. Assistance. Graduate. Graduate. Graduation. Qualify. Qualification. 5.3. Find preposition in C opposite that can be used to make word combinations with the words in the box. Then use the correct forms of the words to complete the sentence. Good interests specialized for 1. A pathologist specializes in diagnosis diseases through examining cells and tissues. 2. A pediatrician must enjoy working with children. 3. An oncologist is interested in the diagnosis and treatment of cancer. 4. A physiotherapist must be good at counseling. 5. A neurosurgeon must be good with her hands. 5.4. Make word combinations using a word from each box. 2 words can be used twice. Look at A, B, and C opposite to help you. Consulting prompts. General practitioner, general practice. Group practice. Health center. Internal medicine, surgical specialties. 5 and 6. 6.1. Make word combinations using a word from each box. Look at A, B, and C opposite to help you. Associate specialist, host officer, on call, provisional diagnosis, radio pager, and word round. 6.2. Match the descriptions 1 to 5 with the job titles A to E. Look at A and B opposite to help you. And D. Graham has been a practitioner for 8 years and is responsible for treating the children admitted to Ward 60. And is letter C. Consultant. 2. Dr. Stewart has just started the second year of the foundation program. The letter is D. SHO. 3. Dr. Syme has started his training as a surgeon. Letter specialist SA, specialist register. 4. Dr. Phillips has just graduated and is working in a large hospital in Birmingham. It's letter E, PRHO, or house officer. And 5, and the last one, Dr. Miller is a charge of the medical staff in the Bergman Hospital. It's letter B, medical director. And exercise 6.3. Are the following statements true or false? Find reasons for your answer in A, B, and C opposite. And I have the part in the exercise. So the only one is true is the number 2. The system of training doctors in Britain is called the Foundation Program. The other ones, and I have in the notebook, so you can see that part. And exercise 6.4. Complete the text of a PRHO describing her job. Look at A, B, and C opposite to help you. When I get to the ward, the first thing I do is talk to the house officer who was on duty during the last shift to find out if there have been any new admissions. Then I generally see the church nurse. He tells me if there is anything that needs to be done urgently, such as intravenous lines to put up or take down. Later in the morning, I clerk any new patients, which basically involves taking a history. On Tuesday and Friday morning, the consultant does her work wrong, and I have to make sure I'm completely up to date on her patients. After that, there are usually lots of things to do, like writing up request forms for blood tests and so on. In the afternoon, I have to prepare for any patients who are to be discharged the next day. They're usually happy to be going home, and then of course there are the lectures and tutorials in the foundation program on Monday and Wednesday. Exercise 7. Complete the sentence. Look at A, B, and C opposite to help you. 1. Someone who specializes in delivery babies in a midwife. 2. Someone who is qualified to assist nurses is a clinical support worker. 3. Someone who is not qualified but is able to assist nurses is a nursing auxiliary. 4. A nurse who has qualified is a staff nurse. 5. A nurse who specializes in the health promotion is a health visitor. 6. A nurse who looks after ward is a church nurse. 7. A nurse who works in the community is a district nurse. 8. Someone who answers in the ward telephone is a ward clerk. 7.2. Make word combination using a word or phrase from each box. Look at the opposite to help you carry out a pressure. Church addressing. Check the temperature. Give an injection. Remove suture. 7.3. Complete the sentence with the correct grammatical form of perform. 1. An isotope brain scan is painless and easy to perform. 2. Biopsy of the pancreas was performed last March. 3. If the patient's condition deteriorates, a lampectomy should be performed. 4. If a diagnosis of meningitis is suspect, a lumbar puncture must be performed. 5. Last year we performed a randomized double-blind group study. 7.4. Complete the sentence with the correct grammatical form of carry out. 1. I now intend to carry out a large study. 2. Unfortunately, few probably controlled trials have been carried out so far. 3. A number of studies have been carried out recently to look at the questions. 4. A triacolectomy was carried out and the patients made a full recovery. 5. This procedure can be carried out in the emergency department. Exercise 8. 8.1. Make word combination using a word from each box. Look at the A, B, C, and D opposite to help you. Ambulance technician, artificial limb, club foot, contact lens, health professional, intraocular pressure, occupational therapist, social worker. 8.2. Which only health professional could best help the following people. Look at the A, B, C, and D opposite to help you. 1. A young unmarried woman who has just had a baby, social worker. 2. A woman who is having difficulty using her right arm following a fracture, physiotherapist. 3. Someone who needs glasses, opticians. 4. An elderly woman who has had a below knee amputation, prosthesis. 5. A man whose wife has Alzheimer's disease, social worker. 6. A man with a fungal infection of his feet, podiatrist. 8.3. Complete the text. Look at the A and C opposite to help you. A prosthesis work with patients of all ages as a member of a clinical team based at a large hospital. The patients may need a prosthesis as the result of an accident or amputations following a disease such as diabetes. Alternatively, they may have been born without a limb. Orthotists work alongside doctors, nurses, physiotherapists and occupational therapists to give the people under their care the best possible rehabilitation. Their main aim is to enable the patients to lead a normal life at work and leisure. An orthotist often works in a clinic as part of an outpatient service and also visit other centers to provide a service for people with special needs. They deal with people of all ages. For instance, children who have cerebral palsy may require splints to help them walk, and many older people need special shoes to correct deformity. If damage any part of the human skeleton may require some form of orthosis. The orthosis may be needed to reposition the body or to relieve pain. Exercise 9.1. Complete the table with words from A, B, and C opposite. Put a stress mark in front of the stress syllable in each word. The first one has been done for you. Verb and noun. Admit, admission. Assess, assessment. Discharge, discharge. Operate, operation. Refer, referral. Treat, treatment. 9.2. Make word combinations using a word from each box. Look at the C opposite to help you. Acutely ill. Assets unit. On duty. Referral letter. Waiting list. 9.3. Which hospital departments will be most appropriate for the following patients? Look at A, B, and C opposite to help you. 1. A woman in diabetic coma intensive care unit. 2. A patient who has just had a radical prostatectomy. High dependency unit. 3. A patient who is to have a skin lesion removed. Day surgery unit. 4. A man with a foreign body in the eye. Gynecology. 5. A woman with a treatment abortion. Acted in an emergency. 9.4. Complete the extract from an information level for patients. Look at the A, B, and C opposite to help you. When you arrive at the hospital, please tell the receptionist who will welcome you, check your details, and direct you to the waiting area. The length of your visit will depend on the treatment you're going to have. You may need to have some tests, such as an X-ray, which could mean going to another department, or you may be referred to other professionals such as physiotherapists or dietitian. You may need to revisit the clinic. If staff at the clinic want to see you again, another appointment will be arranged for you. If you need to be admitted to hospital for more treatment, either as an inpatient or for day surgery, you will be told when this is likely to happen. If you do not need future treatment, you will be discharged to your GP's care. Exercise 10. Ten. 10.1. Complete the sentence. Look at the A opposite to help you. Children over 60s and people with some chronic disease do not have to pay prescription shares in the UK. 2. Patients with mobility problems may be unable to go out. They are housebound. 3. The average GP appointment is 10 minutes long. 4. A locum is someone who takes the place of a staff member who is on leave. 5. Care outside working hours is known as out-of-hours treatment. 10.2. Make word combination using a word or phrase from each box. One word can be used twice. Look at the A and B opposite to help you. change dressing, make appointments, make home visits, perform a minor surgery, refer a patient, run a clinic, supervise messages, take message, supervise staff. 10.3 Which member of a practice team will be responsible for each of the following? Look at the B opposite to help you. 1. Running a clinic, from pregnant woman, midwife, to teaching a patient how to strengthen his broken leg, physiotherapist. 3. Letting the GP know that the patient can't come to her appointment, receptionist. 4. Running a clinic for people who want to lose weight, practice nurse. 5. Visiting a patient who has just returned home after a hernia operation, district nurse. 6. Carrying out check-ups on children in a poor neighborhood, a health visitor. 7. Organizing cover for an absent doctor, practice manager. 10.4 Complete the diary for doctors door afternoon. Look at the A and C opposite to help you. 1 to 2 p.m. practice team meeting over sandwich lunch. 2 to 4 p.m. after surgery, 12 10-minute appointments. 4 to 4:20 p.m. coffee break. 4:20 to 5 p.m. check with receptionist for messages, deal with home visits and repeat prescription requests. 5 to 6 p.m. paperwork, E.G. referrals to secondary care at mid-6, telephone calls to patients, private medical examinations. 6 p.m. phones switch to OOH service. Exercise 11. 11.1 Match these activities to the stage of medical education in the UK given in A opposite. 1. Dissecting cadavers undergraduate, 2. Keeping a long surgical procedure observed and performed postgraduate. 3. Working for 4 months in accident and emergency to experience this specialty. Foundation program. 4. Taking a 4-week attachment in obstetrics and gynecology undergraduate. 5. Taking an online course on recent developments in cardiovascular disease, continuing professional development. 11.2 Complete the sentence. Look at B and C opposite to help you. 1. Just before their final year, students have the chance to take an elective in a hospital of their choice anywhere in the world. 2. Problem-based learning contrasts with an approach where each subject is taught separately. 3. These days lectures are often interactive with regular opportunities for the students to ask questions. 4. In clinical assessment, students learn how to treat and manage patients. 5. Students select modules can be a topic from outside medicine such as foreign language. 6. Dissection of cadavers is an important part of the anatomy components. 7. The medical school at the University of Edinburgh is one of the oldest in the UK. 8. She's a consultant at the Royal, one of the leading pediatric hair specialists in the country. 9. The Royal College of Surgeons in Edinburgh takes from 5005. 10. We have a seminar each week where we discuss topics in a small group with our lecturer. 11.3 Match each of these activities to one of the components of the undergraduate course described in B and C opposite. 1. Julie spent 6 weeks working in a small hospital in the Himalayas, overseas elective. 2. A group of students discussed together the possible reasons for abdominal pain after meals in an obese 44-year-old male, PBL. 3. A small group of students traced the pulmonary artery and cadaver dissection. 4. Otto spends a month working in the pediatrics ward of the local hospital, clinical attachment. 5. Anne learns how to take blood from elderly patients, clinical skill. 6. You must choose to study travel medicine in his 4th year. Student select module. Exercise 12. 12.1. Complete the phrase with verbs from the box. The phrase can be completed in the two different ways. Look at the A and B opposite to help you. 1. Demonstrate. A competence or how to do something. 2. Supervise. Answer anybody ensuring she successfully completes her training. 3. The library. A course of the training program as a teacher. 4. Take a course of the training program as a student. 5. Assess progress or competence. 12.2. Measure the two parts of the sentence. Look at the A, B, and C opposite to help you. 1. And if Y1 is a doctor, is letter D in the first year of the foundation program. 2. A demonstrator is an anatomy teacher, H, who teaches the section. 3. A clinical trainee is a consultant, F, who provides training during periods of direct clinical care. 4. A supervisor is a consultant, is B, responsible for the training program of a trainee. And 5. A medical school is G, and part of the university responsible for a medical education. And 6. Placement is C. A pair spent as a trainee in a hospital or in general practice. 7. A college is A, and a body of specialists responsible for the library and assessing training in their specialty. A fellow is a specialist. E, who has reached the highest level in their specialty. 12.3. Writing the full qualification of the doctors and surgeons. Look at the C opposite to help you. 1. Mr. A. H. Young husband, MBCHB, FRCS. FRCSI. Bachelor of Medicine, Bachelor of Surgery, Fellow of the Royal College of Surgeons of England. 2. Dr. C. Doley, BMED, SCI, DM, MRCP. Bachelor of Medical Science, Doctor of Medicine, Member of the Royal College of Physicians. 3. Mrs. E. English, MBBS, FRCS. Bachelor of Medicine, Bachelor of Surgery, Fellow of the Royal College of Surgeons. Dr. E. Meriwether, BM, MD, FRCP. Bachelor of Medicine, Doctor of Medicine, Fellow of the Royal College of Physicians. Exercise 13. 13.1. What kind of registration might these doctors obtain? 1. An newly qualified Spanish doctor, provisional registration. 2. A newly qualified Nigerian doctor, limited registration. 3. A doctor who has successfully completed the first foundation year, full registration. 4. And show who has successfully completed the foundation program and gained a certificate of completion of training after several specialist register posts. Specialist registration. 13.2. Write the abbreviation in words. Look at the A, B, and C opposite to help you. Any doctor who wants to work in the UK must register with the GMC, General Medical Council. Some overseas doctors must pass the PLAB test before they can register. And Professional and Linguistic Assessment Board. Part 2 of the test consists of the OSCE Auditing Structure Clinical Examination. 4. In any emergency, remember the ABC protocol: airways, breathing, circulation. 5. And the last one, before you can obtain a specialist registration, just must have a CCT, Certificate of Completion of Training. 13.3. Complete the text. Look at the A, B, and C opposite to help you. My name's Musa and I come from Yemen. I came to the UK about 2 years ago after graduating. Because Yemen is outside the EEA, I could only obtain limited registration with the GMC at first. It was very difficult for me to obtain a place on the foundation program. Although I speak good English, I had to take the PLAB test to show that I could work safely in the UK. If I had to give some advice to other candidates, it would be that at consulate stations, you shouldn't simply memorize and say the phrase. It's better to really think about what you are saying to the doctor and get the intonation right. After completing my year's clinical training, I was able to obtain full registration, but I found it difficult to get on CHO posting my chosen specialty. Pediatrics, as hospitals now have to demonstrate there isn't a suitable candidate from the EEA. Once I've completed my second foundation year, I should obtain a CCT, which will allow me to process to specialist registration with the GMC, an important step to the road to becoming a pediatric consultant. So that's it.